Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain-Free with Dr. Marc Darrow from the Joint Rehab and Sports Medical Center in West Los Angeles. This is the program that can give you effective solutions for the pain you've been living with. Dr. Darrow is a medical doctor, board certified through his studies at UCLA, and Dr. Darrow uses stem cell and platelet-rich plasma therapy to heal your body. He teaches about the use of stem cells, PRP, and prolotherapy. Today's program could open up a new life without pain for you. Now, here's Dr. Darrow with his co-host, Nita Valens.
Well, hi there, Dr. Darrow.
Nita Valens, you look gorgeous today. How'd you do it?
Why, thank you. All new makeup and a complete makeover all this morning.
Maybe it's just good genetics.
Must be. So how are you?
I'm living it up, as always, and we're going to have a great show today. We're going to teach people how to have their doctors heal them without surgery. Would you like that if you had to have a surgery and you didn't really need to have it?
That sounds good to me. How will we do that?
Well, it's always a brain twister, isn't it? We're here to take the surgery out of pain.
Yes.
And the way we do it is by using what's called regenerative medicine. That's one of the newer terms about it. Although back in the day, I've been doing this, by the way, for over 25 years. We used to call it prolotherapy, proliferative therapy, meaning to stimulate new tissue growth. Today it's called regenerative medicine, same idea. And back in the day, when I first started doing this, we used, believe it or not, concentrated sugar water to create irritation to grow tissue. Now it's become much, much more advanced. It's morphed into PRP, platelet-rich plasma, and more recently I've been doing that for endless years, but stem cell therapy has come on the forefront. I've been doing that maybe, 12, 15 years now. And I think I'm the busiest guy in the world doing this. That's what they tell me. And I love it. I absolutely love watching people heal. And it's worked on me, and it's worked on me all over the place.
And me too.
Well, just your neck. You don't do all the sports that I do.
That's true.
But we've both had great success with it. And it's a very exciting kind of a life to lead doing this kind of work for me, because anytime I'm injured and I think I need to have surgery, I inject myself and heal the area up. Hey, we've got Amy on here.
Let's go.
Who's calling in. By the way, I want to give out the phone number, Amy, for other people who don't know it. And the phone number to call the studio live right now, and we would love your calls. We love our callers. The number here is 866-870-5752. I'm going to repeat it, 866-870-5752. If you're on a Bluetooth, please get off of it so we can hear you clearly, or just scream at us. We don't care. We can take it.
That's right.
We'd love to hear all the things about your body that hurt, and see if we can help you out. So, Amy, tell me, what's going on, honey?
Hi there. Mark, I actually came in to see you yesterday and got a PRP injection, and it's my first one. And I have to say, I wasn't afraid of the procedure, but it was so smooth and so easy. And then today I have no swelling. Everything feels really good. So I'm really excited about it, and that's just after the first day.
Well, that's pretty amazing. What's your history on this, Amy?
I had been hiking up in Hawaii in December, and knee was feeling pretty ouchy, but sort of ignored it and ended up with a torn meniscus. Okay. Had a big pop as I was walking down one of the steeper climbs, and a lot of searing pain. I was almost afraid I wouldn't be able to walk, the half mile down the hill, and really in bad shape for a few days where I could barely walk. When I went to the emergency, I didn't go to the emergency room, I went to urgent care, and they confirmed it was a torn meniscus, and then I had some swelling, they didn't want to treat me there in Hawaii because I live in Maryland. They preferred that I go home. So went home in January and went to see an orthopedic specialist, received a cortisone shot, and that helped with the pain for a couple weeks. But there's a possibility I re-injured it. But the torn meniscus just wasn't healing. It was still causing me a lot of pain just in day-to-day activities like walking up and down the stairs, things like that. Couldn't really walk the dog, and heard about PRP and was excited to try it.
Well, good. So it's been one day, and you're doing good. That's amazing. And hopefully that'll get better each day. Usually that's what happens, is there's a little bit of stiffness after the injection, and then typically in my own experience and that of my patients, and I say my own because I have injected both my knees. I have meniscal tears in both my knees, and
Wow.
I still do, but when I look under an ultrasound, I can see them. My menisci are degenerated. I'm 74 years old, and I still run all the time. I'm
Right.
down to one husky. The big guy Dakota can't do the runs anymore, but his girl Bella is still running with me. He's 14. She's 11 or so, and she's still doing. Huskies stay young for a long time. So we go up and down where I live in the mountains above the ocean, and my knees are doing great. I've injected them with stem cells and platelets, and I actually had 45 cc's of fluid in my right knee. That's a good amount. That's a big amount. And
Great. I think I had quite a bit of fluid in my knee that
you
took
did
out.
too. Yeah, you had
It was
quite a bit.
amazing.
Yeah, we were pretty
It was
surprised.
amazing. Yeah.
Because when I looked on the ultrasound, it looked like about 2 or 3 cc's, but there was fluid hidden back there, and we got out. I think it was 18 cc's we got out of your knee yesterday. So that'll give you a lot of comfort right there. And I use an ultrasound, as you saw, Amy, so I can actually watch and see exactly what's going on. I saw the needle actually move into the joint capsule where that fluid was, and we were able to drain it all out, which was perfect, every single drop. So for those of you listening, don't ever get any injections without an ultrasound to guide the needle, because you're asking for problems. And Amy, I just want to give you some advice, if I didn't mention it before. I think you're flying home tomorrow, aren't you? Back to Maryland? Yeah. So I want you not to be walking. I want you to save all that walking for later when you're feeling a little bit better. So at the airport, I want you to either be in a wheelchair or a tram. You've seen those when they take people around. Don't be shy. They're you can just ask for it, and they'll take care of you, because people beat themselves up at airports if they've got lower extremity pain, ankle, knee, hip, whatever it is, because they're in a rush and it's a pretty long way to go. So, and they're dragging a suitcase sometimes. So I want you to be in a tram or a wheelchair when you go. The other thing is, you mentioned, that you had a meniscal tear that I guess was shown by MRI. And to me, that doesn't mean anything, because you could have had that for many years. And the way most orthopedic surgeons look at something is they don't realize, and I don't know why this is, that meniscal tear could have been there forever. It could have happened when you're 15 years old. And it doesn't mean because you have that you have pain. A lot of people that we image don't have anything that we can find, but they have terrible pain. And then vice versa, we have people with no pain who have terrible MRIs. So we have to be careful to actually do an examination, look with the ultrasound, see what's going on live, and then treat the pain generator. So that's what we did with you, and I'm very, very hopeful that you're going to get a lot better very quickly. So you may need to come, you may need to fly back and do this again. There's no guarantees that one treatment's going to do the job. I've had parts of my body that I've done, like my right shoulder. I had a surgery when I was in medical school because I was a dummy then, and I didn't know about regenerative medicine. And so I was doing orthopedic surgery, and I literally begged my boss, my professor, to do a surgery because I thought it was so cool. And it's a problem we have with kids too. I have kids come in all the time, high school or college, and they ask, they're pushing their parents to get them a surgery when they don't need it. And once you have a surgery on a knee or something like that, it destabilizes the joint and gets you ready for another surgery. And often people with knees get knee replacements when they don't need them. And I just had an email this morning that I was reading. By the way, my website is www.jointrehab.com. That's jointrehab.com. Every page has a spot to email me. And I got an email in saying that this person was being pushed to get a knee replacement. What should they do? And I have saved thousands of people from surgeries, from knee replacements, shoulder replacements, by doing platelets and stem cells. And there's no reason to do a surgery in most cases. And it's just that it's a societal, cultural thing to do surgery. It's not good for the body, in my humble little opinion. And I was the guy that learned that the hard way. And then after my surgery, my arm blew up like a balloon. I had a high fever. I was terrified. I thought I was infected. It wasn't. It was just probably one of the lymphatic vessels was probably clipped unknowingly to the surgeon, and the fluid that normally goes back to the heart just drained in my arm. And I learned quick, surgery is not the answer, at least for me. If you want to go, if you folks listening want to go do it, I'll support you in it. If that's what you want to do, I always support people. I tell them when they come to see me, if you decide you want to go to another doctor or you want to have a surgery, you can still call me. And I give everyone my cell number. Everybody's got my cell number who comes to see me. Everybody's got my personal email address. And I go, now that we're connected, I'm going to take care of you, even if it means that you need my advice after seeing someone else. That's fine with me. I'm here to help people. So, Amy, my best wishes to you. God bless you.
Thank you. I was amazed at how non-invasive it was.
It's nothing. I know. It is so easy to do these procedures. There's nothing to it.
It really was, it was really so simple. And you and your team, I could tell really, you really were good communicators, too, about what was going on. So I appreciate it.
Well, we all get along pretty good. And we're all there to make people feel happy. And I think that's really what doctors are there to do, is to make people feel happy in spite of what's going on for them. And there's a story it's kind of embarrassing, but the first day of medical school, the director came in and he said, "So what is a doctor?" And I was the only one that raised my hand. And I said, "A doctor is a priest." And this guy, an older guy, started laughing so hard. And the rest of the class started laughing. I didn't laugh because I thought what I said was the truth. I don't mean a religious priest. I mean a minister. Someone who's there to help people, make them feel good. And I still to this day believe that doctors are here to minister to other people. They may be doing high-tech procedures, but, we all hear the stories about the grumpy doctors that wouldn't talk to them. Nita and I had a call a couple of years ago about a woman whose husband had a neck surgery, who came out on a ventilator and, a breathing machine, because probably the vagus nerve had been impacted or something like that. And she asked me what happened, and I said, "I don't know, did you ask your doctor?" And she said that the doctor came in the waiting room and said, "I did everything right," and walked out. And that's an attitude that, unfortunately, doctors often have. They're doing the right thing because they're following the textbook, but it comes out bad. And we know that, I think, Amy, you work in healthcare. You know this.
I do.
Iatrogenic causes of problems come from doctors, medicines, hospitals, surgeries. That means that the third cause of death in our country is from iatrogenic things. That means the doctor did it, the medicines did it, the surgery did it, the infections in the hospital did it. And we try to do things naturally. That's something that I've been trained in. My grandfather was a natural doctor. He used mostly placebo. My job with him every Sunday was to fill up bottles with cherry syrup, and that's what he would give his patients. And I've had it happen to me. I've gone to doctors and have them touch me, put their hand on my shoulder and say, "You're fine." And all of a sudden I'm fine. We call that placebo, but we know that 30 to 40% of people heal from placebo. And people say to me, they say, regenerative medicine, it's not real. My orthopedic surgeon buddies call me a buffoon for doing it, and I call them an idiot for cutting people. But when people say, is it placebo, I go, I hope so. The difference, though, is placebo works 30 to 40%. What I do typically works about 80% of the time. And the failure rate is typically from people being too active afterwards. They don't give it a chance to heal. Or they've gone to a bad doctor. Somebody doesn't know what they're doing. Or they just don't get enough treatment. They think it's supposed to be a miracle. And to me, it's a miracle. But sometimes the miracle is listening to the doctor. And what I tell people is, please give it a chance to heal. Stay off of it for a while. So, Amy, God bless you and your healing. I hope it's coming soon. Hopefully by tonight, the stiffness that we created by your injection will be gone. That's very typical that happens. And you have my cell number. I'd like you to text me every day when you go back to Maryland and let me know how you're doing, okay?
I will. Thank you so much. I really
All right. God bless you, Amy. Thank you so much for calling in.
Medicine.
Thank you.
Take care.
Yeah.
Bye-bye.
Yeah, that was a great call, Amy, because we got to talk about so many different things.
Yeah.
So, Nita, I'm going to give out the phone number again. Let's get some other callers.
Okay.
The phone number to talk to us live right now is 866-870-5752. That's 866-870-5752. You can also call the office. I'm going to give out that phone number. If you want to get an appointment or you want to talk about things that we haven't gotten to, the phone number to the office is 800-300-9300. If the phones are busy, just leave your name. We'll get right back to you. That's 800-300-9300. And of utmost importance is my website, because there are videos on every page, and there's a spot to email me. So I hope you're not too shy to call. You can use a fake name or pretend that you're Nita's sister or something.
Yeah, I have two. I can use more.
Yeah. Go to the website. It's www.jointrehab.com, jointrehab.com. And there's a spot on every page to email me. I answer emails daily, all day, all night, all morning, and in between patients. I love it. I love communicating with my patients. So I will go to a call. No, I'll go to a question. I'll go to a question.
Okay.
Well, first, let's do a little joke, Nita.
Oh, I think we need more information before the break. I think you should go to a question.
Why? You're smart. You can handle this. Okay. By the way, if anyone calls in, which we hope they do, they're going to get a free copy of my book, which is Stem Cell and Platelet Therapy, Regenerate, Don't Operate. It's a $25 book, and I'll actually pay the postage for it, too. It's an amazing book. It took me 5 years to write it. It's got 250 studies, I think it is, about why regenerative medicine works, how it works, the science, and why you should not get a surgery unless maybe it's an emergency. But then I'm not so sure what an emergency is, because a lot of doctors say it's an emergency when I don't think it is, and we heal the people using their own platelets or stem cells. So I will talk about one thing before we go to a question.
Okay.
We also use these cells from your body on your face, and it's called the vampire facelift. We can grow back the collagen in your face and make you look younger again. Also, it can be used on the top of the head for people with thinning hair. It could be men or women. And the platelets and or stem cells can revitalize the follicles and grow back the hair. So it works not only on the musculoskeletal orthopedic system, but also on the face and the hair. There are many studies being done on platelets and stem cells for the organ systems. I don't do that. I don't do IVs, but other doctors do. And that's more in the experimental phase. I don't think what I do is experimental. I've been doing it 25 years. And I actually do studies in the office on it. There's tons of studies being done on this. And people come and they go, my orthopedic surgeon said it's experimental, I shouldn't do it. And I tell them I think surgery is experimental and can hurt people. I get people in the office almost every single day who come in after a failed surgery that made them worse. I'm an example of that with my shoulder. And I tell people to stay away from surgery unless it's an emergency, and then, get to the surgeon, get their opinion, and then let me know what they say. So let's see if I can get a question here. Nita, you're breathing. That means you want to say something.
No, I just accidentally was breathing. No big deal.
Nita, you're so cute. Let's see here. Okay. Oh, here's an oddball. Osteoarthritis in hands and neck.
Oh.
Wait a minute. Did we do that one last time? Well, I'll do it anyway. Some people have arthritis all over their body. They can have erosive or metabolic arthritis. That's a little different than osteoarthritis, which this person says they have. It gets more complex. I just had a patient come in with psoriatic arthritis, they said. And I examined them, and I said, I don't think you have psoriatic arthritis. You probably went to a rheumatologist who needed to give you a diagnosis, and I don't think you have it. Yeah, you have, I think you have psoriasis, and I don't think that means that you're having a problem with psoriatic arthritis, which is a very destructive arthritis. I looked at his hands, they looked fine, and he was complaining of knee pain, they looked fine, good range of motion, and I think he probably just had some osteoarthritis. I ordered MRIs and x-rays to find out. With psoriatic arthritis in the fingers, you often get what's called a pencil in the cup deformity, which is erosive, where the bones actually get eaten away. He didn't look like he had that. He didn't have the typical sausage digits where the fingers can blow up like a sausage. And I'm hopeful that he just has osteoarthritis, which is easier to treat. I do treat psoriatic arthritis. I treat rheumatoid arthritis. I treat it all. I had something also interesting. I had a woman call from Wyoming yesterday, and her daughter is 15 and has laxity in her joints. And there was a disease name for it, and I said, please don't call it that. You're going to brand your daughter with something that I don't think she probably has. And that's Ehlers-Danlos syndrome.
Oh, yeah,
and
I know what that is.
You've heard of that, right, Nita? And I get people in with all these diagnoses. The first thing I do is talk them out of their diagnosis, talk them into their healing. Because when you're stuck on a diagnosis, it's hard to heal. The mind thinks something is broken. So what I do with this is I say, yes, you have some pain. Yes, your MRI says something that looks bad. And yes, I think I can help you heal. And often, most of the patients that I choose to help heal up. So we have to be careful. The phone number again is 866-870-5752. We're going to go to the break. Stick with us, and we'll come back for another half hour of wonderful questions on how to heal your musculoskeletal pain with your own platelets and stem cells.
Sounds good. This is Living Pain Free with Dr. Marc Darrow. I'm your host, Nita Valens, and we'll be right back.
You're listening to Living Pain Free with Dr. Marc Darrow. Dr. Darrow's practice is located at the Darrow Stem Cell Institute in West Los Angeles. To schedule an appointment, call 1-800-300-9300. That's 1-800-300-9300. Dr. Darrow will be back in just a moment. Stay tuned.